I have to be so present in my body in the moment because I could die if I don't wrap the silks the right way. But then at the same time, you're wrapping yourself in a very complex way. You're 15 feet up, you're leaning forward, and you have to let go, and you fall, and you have to trust that the fabric is going to catch you. Like even now, I'm just thinking about how powerful that is emotionally.
Oh, this is major. It's like the next big thing. Come catch the wave, yeah. Yeah, watch what's happening. A force of nature. Hit 'em like lightning. Be the creator of the next big thing. We're the movers and shakers. We are the dreamers, the makers. We stand on top of equators. We are the limitless. We got the future, no papers. We are the innovators. We have the focus like lasers. You know we doing it big. Oh, this is major. This is major. It's a game
Welcome to
changer.
the Compromise to Alchemize podcast with your host, Dr. Neil Bolton-Donnie. I'm excited for this episode that we did with Dr. Emily Splichal. She's amazing. She's a functional holistic podiatrist, but really, she's also a foot and movement specialist, global author. She is also a movement longevity expert. It's kind of amazing, all of the things that she does. I'm just kind of stunned by the fact that she knows so much, not only about the feet, the pelvic floor, the whole body, but also sensory system, and just even the way that she is involved in functional medicine, anti-aging longevity medicine, like work with exosomes and stem cells and all these good things. So I am just very impressed, and it's been a great pleasure to get to know Emily some. We've got an upcoming collaboration as well. On October 28th, we're doing a webinar, and that is Dr. Emily, and Dr. Mandeep Johal, and myself. So Emily will be covering the foot. Mandeep Johal is dentist who will be covering the airway aspects of the dentistry, and then I'll be covering the floor of the mouth. So stay tuned. Look to the show notes and social media posts for links for that. So if you're tuning in and you are curious, we're going to talk about gravity. We're going to talk about the sensory system. We're going to talk about dance. Yes, Emily not only has a history as a competitive gymnast, but she's also currently a competitive ballroom dancer, and she just competed. So she's got a lot to draw from, and she does draw from all of that. So she's been on Oprah. She's been on the Rachel Ray show. Like, she's got this company called Naboso that's been around. I've been following her since back when that company started, and I know that the texturized kind of sensory apparatus that they're really great tools. So I'm excited for directing more people to those resources. But without further ado, I want you to enjoy this episode. Stay tuned also, because I've got my community launching soon, the Embodied Voice, where we'll talk about not only the aspects of the anatomy, which when it comes to the mouth, the tongue, the airway, but also the anatomy of intuition and agency and reclaiming voice. So really excited. That fits right in line with my my belief that we need the feminine voice to skyrocket and emerge and arise, and that goes along with this awesome song called Major by Luna Lux that is now on my intro. So just want you all to enjoy. Please comment, share this. We want to know how this is.
We are the innovators. We have the focus like lasers. You know we doing it big. Oh, this is major.
All right, I'm here with Dr. Emily Splichal, and I am so excited for our conversation. It's been really good to recently get to know you, but I've been following your work for years. And I think when I found out you knew Mandeep Johal, which is a great friend and colleague of mine, and then I also saw you on Ben Greenfield's podcast, and I'm connected with Ben on his team and all that. And so I was like, all right, I got to reach out. And you were gracious to respond, and we've been in a flow since then. So thanks for, first of all, coming on the podcast. And I'm really excited to have this conversation and many more with you.
Of course, thank you. Yeah, I'm excited to start that conversation and honored to be on your podcast.
Yeah. So I feel like we have many worlds and webs to dive into. I know, like, and I'll start with what I'm like really inspired by, but then you go where you want to go. But I mean, aside from, as we know, the founder of Naboso and how that's been such an amazing resource for people. I love that you're not just a holistic functional podiatrist and many more things. I mean, we share a love of talking about gravity and interacting with that. And I really want to, I love talking more about that. But I also love that you do functional medicine and we're talking like stem cells. That's amazing. I feel like now I want everybody that I know that ever needs a podiatrist to come see you, but I know that's not possible for you to see the whole world. But it's amazing. Oh, I can't believe I forgot to mention this, but crazily, I was in Scottsdale, Arizona, putting on a floor of the mouth tour training in
Oh,
mid June, and I didn't know you lived there. So
just stop by.
crazy. I could have totally met you then. So I missed that. But yeah, excited to dive in and talk about the many worlds that you do weave together. Because usually, I know you're past the point of being this expert practitioner and you do care and you help people, but you're also leading a movement that's way bigger than one person. That's why you're globally known. I was even listening to the work that you do in like collaborating with the whole like vibe plate technology and all the worlds that are there too.
Mhm.
So it's just so cool to see how diverse yet connected all these worlds are that you navigate. So, you know, maybe where I want to go with that is instead of jumping to those individual modalities, I think you also have a history in dance. Is that right?
I do. Well, I have a history in gymnastics, and
Gymnastics.
then now
Yes.
I'm a ballroom dancer. I was an aerialist.
Wow.
So
Okay.
love I love movement, and I think that helps me just continue to explore my work and my message, products that I innovate, dots that I connect in how I look at human movement, emotion, connection to self, purpose, all of the things that I know that we're going to dive into. But to me, a lot of that is rooted in moving our body and how we feel when we do move our physical body, how we feel connected to ourselves as we are moving is very powerful.
Yeah, and I know you talk a lot about emotions, and the mind body. And if we go back to like gymnastics is your way of, for sure there's mental physical with that and that. But did you have like a practice of the mind or mindfulness that you did back then? Or was there something else? So how did you get into like understanding the mind and then emotions and all of that too?
Yeah, so one, I was younger, and that was way
Uh,
before fascia was known. I wish I
right.
was younger than I am, but no, I was a gymnast many, many years ago for
Uh-huh.
13 years. From age 6 to age 19, I was a competitive gymnast, which subconsciously that sport instilled obviously an appreciation for the power of tensegrity or fascial tension,
Hmm.
which again didn't know at that time that I was using, and then my feet because it's a barefoot sport, and how that ties into the whole body, your breath, etc. As I got further into my professional career, because it was built off of this foundation, I mean, to start from 6 years old, your entire most of your childhood into your teenage years is built around the discipline of a sport that requires intrinsic motivation. Like you have to practice. I would practice 4 hours a day and someone's not sitting over you. You have to take that upon yourself to
Hmm.
want to get better, to do the drills, to do the routines over and over. So that is always part of my personality is that aspect. But as I push further into other aspects of movement, like aerials.
Hmm.
Aerials was the first time that I truly, truly connected to the power of emotion in motion. And anyone who's ever seen aerialists or known aerialists, this is like Cirque du Soleil kind of style of
Hmm.
it. it is very, very emotionally freeing because you are doing something that is dangerous. If I'm 12 to 15 feet up in the air on the silks, I have to be so present in my body in the moment because I could die if I don't wrap the silks the right way. But then at the same time, you're wrapping yourself in a very complex way. You're 15 feet up, you're leaning forward, and you have to let go, and you fall, and you have to trust that the fabric is going to catch you. Like even now, I'm just thinking about how powerful that is emotionally. It's
Yeah.
so freeing emotionally that that was the first time. And I did aerials for 8 years. And it
Mm,
just it completely changed who I am as a human being. And then I had my daughter, life happens, and now the past year and a half, I got into ballroom dance.
mhm.
Ballroom is a little bit different. Obviously, it's not dangerous. I'm on the ground, but there's an element of to truly move through ballroom, you have to let go. You have to be fully present and feel and connect with your body, with your partner, with the ground. It's really, really powerful, and that's why not only as a podiatrist, but as a human movement specialist, I'm such an advocate of getting people to explore movement, whatever that means to them, even if it's just a walk. But movement is so powerful to how we identify with ourselves, how we express emotion, how we feel our body. It's very powerful.
Yeah, and I want to jump back to like the right back to the movement part. But oh, I'd love to go back to your ballroom dancing. I have a history in dance, more in interpretive dance, and but I
Mhm.
have hip hop, flexing. I was a raver, not
Wow.
anymore. I just got out of that world, but I emulated Michael Jackson and something. I don't know if you've seen. Have you seen Footloose? Right, that
Uh-huh.
movie at the
Yeah.
end when Kevin Bacon and all those guys are dancing. Well, there's the guy in the white suit who his whole body turned into liquid. That's
Uh-huh.
Neil. That's Neil at events was the liquider.
I
So
love it.
and you know what I used to get really into that, and I still will bring that out every once in a while. But liquidding is really specific because it's a postural art that has mime integrated with it, and inevitably it's about the expression of emotions through movement. And so for me, I had such a home in that, and
Yeah.
before I really knew how to make sense of the world around me, and before I even had like the ability to express verbally as much as I do now. Movement was such a beautiful answer for me when I didn't know how to put things into words. And so for me, also, that like expressive art that movement can be is really beautiful. So some people, they would come to my workshops because I taught intuitive movement workshops, and they're like, Neil, I'm not a dancer. I don't want to dance. Right.
Yep.
I taught it around the world for a while. And I'm like, you know what? Forget that. It's not about dance. It's about moving and about knowing yourself in movement and getting acquainted with who you are. So I love that you express that part too, because I'm like, I don't want people to think you have to be a ballroom dancer, although that's pretty cool. So yeah, I love that you have that. So tell me more about like for those who kind of like too, whatever movement practice you might have, how would you feel like there's a poetry with ballroom dance, but could you speak to like a movement when you walk and how is there a poetry you have with that? How does your ballroom dancing influence your movement in life?
Yeah, absolutely. So let's say we are just talking about walking. And when I teach people about walking, here's a fun fact. I actually used to teach women how to walk in heels and men
Mm,
probably too. But
okay.
I would teach about the clearly when you're walking in heels, you're trying to walk a certain way than a purpose of like, I need to get into the grocery store. Like
Yeah.
you're probably not strutting into the grocery store. Maybe some of those are, I don't know.
Right.
But you want to. Um, but clearly when you're in the heels, you're on the runway or you are doing something from that element of a performing or whatnot, you have to have a high level of awareness, but you have to have a fluidity. And this is why
Mhm,
I love talking about walking and other certain movements is because there's a fluidity to that movement. There's a rhythm, there's a grace. And to do
mhm,
that, we mentioned this slightly, is that you have to have a relationship with gravity and you
mhm,
have to essentially lift into gravity versus succumbing to gravity or being heavy, being passive. I think that a lot of people are passive in their physical body and don't understand that when we actually kind of create tone in our fascia, right? I say hello to gravity. I'm saying hello to gravity. I'm
Hmm.
pushing into it, right? I'm like, hi, I'm here. I know you're there. I'm here, right? We are dancing together. You actually create a lightness or you create space.
Hmm.
So if I walk with that awareness of talking to gravity, I'm actually walking much lighter, almost like I'm floating as I'm walking across the floor. You could see this in like martial artists and Tai Chi, and there's certain methods, Eastern methods, where they're very floating and graceful in their movements. And it's because of that connection to body and to gravity. So I try to carry that into how I teach people to move. How I move myself is that there should always be an ease of movement.
Hmm.
And part of that also, which is part of the industries that I'm in, is that a lot of people think about movement calorically. Like,
Hmm.
I'm moving, I need to move, I need to do so many steps a day according to my Fitbit or whatever it is, and it's just about caloric expenditure versus it being this opportunity to feel your body, to connect to your body, to, wake up the nervous system, to feel a freedom, to do it outside, and now you're connecting with nature and you have all those benefits as well. So there's much more power behind a movement and the graceful, gravitationally connected movement, fascial movement that I focus on.
Yeah. Oh, I love that. And I've heard you definitely, I've tuned into some of the way you talk about gravity, which is I love. And I really love that kind of ease. Like there should be an ease of movement that you talk about, and a
Mhm,
lightness. And I feel like with when I'm working with people, or when I'm even thinking about my own movement patterns, I could definitely think of those times when I felt so heavy that I felt
mhm,
like my feet weren't really springing. Um, One example is when I was wearing these really like thick shoes, first of all, and then second to that, the insoles, they were off gassing chemicals, and anytime I would walk in them, I'd feel like smoke was coming out of my eyes, and I felt like gravity pulled me down. Take those off, and I was like, wow, instant change. So that's the chemical
mhm.
part that we talk about, but then. Um, Aligning ourselves with gravity so it's our friend, because some
Yeah.
people, when they're in pain and they're dealing with these issues, they can't help but feel that, their forward head posture and the
Mhm,
concrete, like the ground isn't kind. And so I love that way that you talked about a conversation you have with gravity, because it's
mhm.
this beautiful exchange that can happen.
Yeah, no, absolutely. What I do wanna share on the opposite side of it, which I did learn as a gymnast, and then I have a ballroom competition tomorrow, so I
Oh
it's kind
yeah.
of in my mind as far as doing it,
Yeah.
is that just as much as we have to be fluid and liquid, I actually kind of like that analogy of like we are liquid, we are fluid, we are dancing, we are kind of, interplaying with the ground and gravity in every step we do. To me, there's a lightness in that movement. However, on the other side, which is really, really powerful with understanding the human body and gravity, is the power side
Yeah.
and the strength side that
Hmm.
I learned as a gymnast also, and then doing aerials and acrobatics and kind of stuff like that, is the other side of fascia, which is the tension and like the stiffness. And that is your ability to contract the muscles. Like I'm contracting my hands isometrically. But when we do that, what does that do up the entire fascial sling into our system to create stability and power? That flipped side of the fascial function or your gravitational story is also very important for people to understand, right? Because if I'm liquid, I'm walking to the baggage claim liquid, but when I pick up my luggage off of the luggage rack, I need to create the tension, right? The stability and the stiffness in my system to be able to lift that load and not hurt myself. Like that's kind of a functional interplay. And what made me think of it is that when we were talking, I was thinking about my daughter who's 5, but she's a for her age, she's a high level gymnast. She practices 10 hours a week at 5 years old. So
Wow.
she's way better than mama. Um,
Mhm.
but she's still really young. So her movement literacy, right? Half of how we learn how to move is through mirroring
Mhm.
until we learn the literacy and the vocabulary, almost like emotional intelligence is you need a little bit more life experience to get the intelligence. So my daughter's movement intelligence or literacy just isn't there yet because she doesn't know these concepts that she'll do, like let's say a handstand. She's holding it and balancing it, but it's out of like sheer, not luck, but
Mhm.
she's kind of because she's small and compact, right?
Mhm.
But she needs to understand, like, when you do that, what happens when you really engage your foot and you really point your toes, or you
Mhm.
push your fingers down into the floor like a hand balancer. And this idea of tensegrity isn't inherent in her body yet. And it's something that, so that's one thing that the listeners I would also encourage them to play with is how do you play with fluidity and then how do you play with stiffness? And stiffness isn't like my neck is stiff, like joint stiffness. It's a fascial concept to how we create power and force within our system, utilizing the energy that is given from gravity. So it's to
Yeah.
me, that's another element of movement that I find so fascinating and beautiful, also.
Yeah, and I love that interplay because just what you were saying, it's like we have to have that dynamic ability to interact with the earth and the floor and whatever surface we're on, or vice versa. If we're experimenting with, like I love to experiment with moving. When my daughter was 1, I would wear her, or younger, I would wear her in a carrier, and I
Hmm.
would get huge palm tree fronds, and I would wave them in the air, and then I would like essentially do calligraphy in the air, and then I would do that with the tip of that palm tree frond
Hmm.
on the ground, and I would experiment with how I needed to support and scaffold my body so that I
Hmm.
didn't just fall, or so that I could wield that big palm tree frond and exert enough appositional force to it so that I wielded it instead of it wielding me, because you know carrying my daughter, I didn't want to fall on the ground. That would have been good for her. But I think,
Yep.
I also think about my time at the Tamalpa Institute in the Bay Area, San Rafael, and I was just in the area recently where I did some training there. It was very much the intersection of psychology and movement. But anyways, on this beautiful wood floor where the legend Anna Halprin has taught many people, and I learned from her and Rosario Sammartino, and the hours of movement that if it was all fluid, we would just kind of ooze to the ground. But there were moments when we were jumping, leaping, and it's
Hmm.
this kind of feeling of like percussion with
Hmm.
the ground. And so it's like if I didn't have that strength and internal scaffolding and that kind of good tension, then I wouldn't have been able to create those percussive movements with the ground. And there's a certain girding up that you have to do so that when you do land, that you're actually percussive and not just jamming your bones against the ground, because that would be
Hmm.
painful. So I
Yep.
think some people kind of feel like that. And I've had these people at my workshops who they're like, Neil, those movements are scary for me. And I'm like, that's okay. You don't need to leap in the air and then hit the ground with force. But
Hmm.
just think about every time you take a step, if the ground meets you, how does it meet you and how do you meet it? Like baby
Hmm.
steps. So
Hmm.
I love that you talk about that in like a way that's going to be relevant for people, because not everybody's going to ballroom dance, but everybody is going to walk, and
Totally.
therefore walking is such an art form that could be a great way to do that. And kids are a great example of that. That they just move, and then I have a 5, 7, and 9-year old, and my 7-year old, he will walk on the ledge, along windows, and he'll jump from high surfaces, and I'm like, wow,
Hmm.
he just gets it. Whereas our 5-year old and our 9-year old, they don't in that way. Whereas our 9-year old has this grace of fluidity that she really has. So it's really fun to
Hmm.
see that they're mirroring some of that in me and my wife, and they're learning that.
Yeah. Yeah, no, I love the mirroring component of movement. And that's how children learn is I mean, adults learn that way as well, is that we mirror, but there's something very special about seeing, the movement naivety of a child evolving through the mirroring of adult
Yeah.
years.
And
Yeah.
how does that like too? I mean, I'm sure as you've kind of worked with many, um, and you bring in, I know I've heard you talk about bringing in like that playfulness with some people, how they can engage with that. Like, and I guess movement literacy is a word I love as well. When you talked about that, when you're engaging with people and like looking at them and reading them, kind of on that whole spectrum, like how do you decide what's going to be helpful for someone? Because I know you have your like there's a lot you understand and you teach people. How do you kind of interpret and see what kind of person needs what kind of way when it comes to teaching them how to move in ways that are with ease?
Uh, so I mean, a lot of it is based off of the way that they're presenting structurally. So I'm determining their structure, of course, feet, posture from the ground up. Just this
Hmm.
is your baseline structure. And I take that over here and then I look at potential injury or pain or transfer stress. So there's some sort of something's talking to them. That's why they're seeing me most likely is it plantar fasciitis? Is it
Hmm.
Achilles post tib? Could it be higher where it's low back, groin, lateral knee? Sure, somewhere in their system is talking to them, which is then telling me a little bit more about their movement and their potential ease or lack of ease of movement based off of the structure, how they're talking. And then I'm doing an actual assessment and understanding that component. I think that movement presentations are very complex, and what works for one is not going to work for all. There's different volumes, there are different structures, there are different injury histories. So my first step when I see a patient is actually just educate them, like an awareness, right? Is
Hmm.
I'm just saying, I'm going to take your videos and your photos and I'm just showing you. So I just want
Hmm.
you to be aware. And then I want you to understand, like, let's say walking, this is how we walk. We are supposed to walk with, these longer strides, striking the lateral heel. And I go through how the foot moves. But I'm also saying, okay, this is what's happening in the pelvis. This is what's happening in the T spine. This is how your arms are supposed to be moving. This is kind of how your head is. And this is why we need to move that way, right? We were designed to move with these long strides and contralateral movements that is essentially all these rotations are being negated through the spine. So they're kind of counter rotated all the way to the head so that your eyes and your ears stay stable. But below your head, there's a lot of movement happening. That movement is dissipating and transferring so that the body can actually use the energy from gravity and from the ground. So it's being
Hmm.
kind of absorbed within the body so it can be released on the next step. And we just essentially go back and forth between absorbing and releasing this energy from the ground. That's how we're supposed to. So I just explained that that's how we were evolutionarily designed to move. And the reason for it is, for efficiency, etc. This is you moving. This is your structure. This is your feet. This is maybe you have genu-valgum, so you have knock-knee, bow legs. You have increased lordosis. Your shoulders are internally, whatever the structure is. And I'm showing them that. And how could that potentially affect the way that we need to move, that we were designed to move? Here's an assessment of you moving. This is showing me limitation here, increased risk of transfer stress here. So I just want you to take in what that means. My goal is never to structurally take someone from where they are now at 55 years old to where their body was when they were 15 structurally.
Hmm.
That's impossible. You can't do that. That's not the goal. But the fascinating thing about the system is even a slight reset to the nervous system and the fascial system will decompress and take pressure off the system and bring even a slight ease of movement, that everything's good, right? And I call it riding under the radar. We're just trying to
Mm,
like stay below this threshold. We are never seeking perfection. We are never seeking symmetry because I don't believe that
yeah.
those exist in the human body, especially
Yes.
actually the moment you're born, you are asymmetrical because you
Right.
spiral out of the womb a certain way,
Yeah.
right? So symmetry does not exist in the human body and human movement. And I just let them know that that's okay. So that's my first step. Then I teach them ways to feel their body, to connect to their body, to connect to movement, to reset the feet, to activate the fascial slings. And I try to carry it off of that. But everything I teach is based off of a lifestyle,
Mm,
that I'm essentially wanting people to embody this as a lifestyle. Like healthy feet, or an awareness of the role your foot plays in human movement is a lifestyle. And that is what I teach versus
yeah.
do this program for 6 weeks and you're good. Take
Yeah.
care. No,
Yeah.
that's not. Yeah.
Well, such a yeah, it's such a multidimensional way that you're looking at someone and showing them so that they can learn about themselves in a way that they maybe don't know. So it's kind of like I could imagine just that first step in the complex analysis you're doing is a mirroring and an affirming and a validating to one's current state, but then some hope for like the help that you can bring them. I
Yeah.
love the comment you made on asymmetry. I say this all the time to people because I talk about embryologically how we form, what happens at certain
Mhm.
stages. So some people are like, when I tell them that we are born asymmetric, they're like, what do you mean? And I'm like, well, and I do talk about the spiral, but I'm like, well, first of all, think about our organs and think about how we don't have symmetrical paired organs, the
Mhm.
fascial visceral orientation, the way
Mhm.
that those place themselves in our bodies, the way that our body moves according to that. Automatically, hands down, we are asymmetrical, and that means from the get-go we don't have symmetry. But then you add to that anything that happens in utero that are complex or like trauma or even tongue tie, airway issues,
Mhm.
palate malformation issues, that just throws the already current spiral pattern into a more torqued, more intense situation. So, right from the get go, I think it does give people like relief when you're like, yeah, we're not going to put you back into some perfectly symmetrical state
Mhm.
because, first of all, I'm sorry to say you were never there. I know that
Mhm.
you've gone through something, whether they've gone through a surgical intervention or trauma or accident or whatever it is. They're like, their goal is to get back. And I'm like, let's go towards something that is supple, resilient, where you have, I love how you said, is it just like under the radar? So, nervous system that has some ability to make you um, in harmony and accord with the stresses that are around you.
Yeah. Yeah. I
Yeah.
think balance is a great word. I just am seeing that a lot, right? We're just
Yeah.
trying to be a little bit in balance, and then we ebb and flow through these different states and stresses in the body, knowing that, you know, we are human and we have our life. So sometimes there's going to be, I don't know, I have to sit on a 12-hour flight to Asia for
Hmm.
work, which I do all the time. And inherently, that stress is unnatural to the human body, right? So, how how could that potentially throw me off of my balance? Over here now, my hip is killing me, my back, I'm stiff, all of this. So how do I reset? So I try to empower the patient also with the tools. That's why I educate, so that they
Hmm.
understand their body. I'm giving them the tools so they understand when there's a certain stressor or something tips the scale a little bit this way. They understand how to bring it back to balance a little bit more over here to then become under the radar again or quiescent. Oftentimes I'll say
Mm.
that again to a patient is, we just want this to be quiescent, right? I don't care what the MRI says. And I work with a lot of chronic plantar fascial tears where I do injections because I am trying to heal tears in the tissue. which is, a whole other conversation over here as far as connective tissue integrity and how I try to help a patient get closer to connective tissue integrity. But even at that, if we have an injury in our body and it's quiescent, we're good. I don't need to reverse the knee osteoarthritis if it's quiescent and I understand how to manage it in this state over here. Um, I just think, again, sometimes people are seeking, especially in the anti aging longevity space, they're seeking this reversal of
Hmm.
aging processes in certain ways where sometimes just keep Pandora's box closed over there in this quiescent place and we're good.
Yeah. Yeah, I love that. I mean, and I just, yeah, to speak to like that, I love how you utilize these anti-aging longevity, kind of modalities, if you want to call it that, with like stem cell and that. So I would love to dive into that a little bit. And in kind of what I do too, it's like I, we've guided a lot of people through peptides, proper peptide usage, and through many of all the biohacking technologies out
Yep.
there, and whether we're like talking about optimizing performance and like going to that next level with these high performance athletes and people like that, or we're talking about people who have been so debilitated with Lyme's or other conditions, and the combination of many, that they've had to seek out all these technologies and all these modalities just to feel okay.
Mhm.
um, I love that place that I've been able to be in, at least I'm sort of a reference person, a guide, and a person who directs people. I almost always, wherever I'm at, I'm going to collaborate with and have somebody we cross refer with that
Mhm.
is doing these stem cells or PRP and et cetera. So you're the first podiatrist I've known that's actually doing that. And that's not just it. I mean, you're talking about incorporating so much more about movement sense, gravity sense, talking about lifestyle. So I don't know if a Swiss Army blade would had like four other knives attached to it, and we called them not knives but something healing. That's who you'd be. There's like so many things wrapped up
I
into
love
one.
it.
But
I
yeah,
love that.
I mean, like, I love that. Tell me about like, whether it's like a case where you did some
Mhm.
things and then you realize, oh yeah, we do need to do that stem cell therapy. Like, love to hear a little bit more about that. And some people I know, I have so many patients who we work with the feet a lot. I help so many people. But when you have those limitations of matter and that the state, they need more. So I'm like,
Yeah.
wow, what better person to help them than a human movement specialist who also is a podiatrist, who also has this advanced knowledge. So yeah, I'd love to hear more on that.
Yeah, I thank you for asking that because that is one of my favorite topics to talk about is
Mm,
the regenerative space and the way that I look at it and the way that I utilize it is through this understanding of how our connective tissue is really neurological tissue. It's an extension of the brain based off of how many nerves are found in this saran wrap, right? So there's 100 million sensory nerves in this saran wrap. So when you have a tear, so let's say a partial tear of the plantar fascia, um, you have a tear in a ligament, you have a tear in, I've dealt with this personally where I've had athletic pubalgia, where I had a tear in my rectus abdominis fascia.
mm,
So what happens when you get a tear in connective tissue, which is neurosensory tissue, is it throws off the neuromuscular coordination of stabilization around that area, which sounds like a lot of words, that everything
mhm,
just freaks out and kind of locks down to try to stabilize from the disconnect that that is creating. Sometimes I'll explain to a patient that it's kind of like a monkey wrench or like a sweater that's unraveling or something, right? Where you're just like, oh, it's this,
mhm,
and then you have this like, loose thread in your sweater. Like it just kind of is continuously unraveling the progress that you are trying to achieve through your work.
mhm,
And then specifically in the foot and the ankle, such as our plantar fascia, which is such a highly stressed band of connective tissue for energy transfer. So it is inherent to how we stand and walk and move and push off, etc. Is the elasticity and the stretch and recoil of this tissue 10,000, 20,000 times a day. So if you have a tear or a break in that connective tissue, you're always going to be held in this certain state. Now, before I did different regenerative injections and approaches, I was trained as a surgeon,
Mm,
and I did surgery through residency. I did surgery for 5 years out of residency. It was part of how I was taught through conventional medicine to be a podiatrist is through a
mhm,
surgical lens. Thank goodness I was brought up in a home where my mom was very into supplements and alternative health. I mean, I used to get vitamins for Christmas and I loved it. So
mhm,
I always had this curiosity in the anti-aging longevity space. And when I was a student, I would go to the American Academy of Anti-Aging Medicine conferences. And they would just be like, one, why are you here? Because you're a student. And why are you here? Because you're a podiatrist. They didn't see, or a podiatry student on the track to be a podiatrist. They
mhm,
just didn't get that space. So I carried that lens with me as I was going through surgery, seeing mixed results, seeing patients pushed towards surgery faster than I thought that they should be, got into regenerative medicine and the regenerative injections and started to see this powerful potential for patients that preceded the surgical option. So I started to offer them to patients, partly because I intrinsically believed in them, looked at the research, sure, but then started to get the patients responding to it. And long story short around it is I've evolved then just through really believing in them, understanding human physiology and the healing process, um, understanding the progression of how load and tissue stress thresholds are strengthened. So this whole bucket has evolved into how I very uniquely do regenerative injections in my office. So I will follow patients for 3 months. I actually don't believe that the magic is in the injection. The magic is the injection works synergistically with other modalities. I will have patients do shock wave, then I stack it with the
mhm,
injection, then I have them doing photobiomodulation or red light therapy for 3 months. I have them doing systemic enzymes for 3 months. So we're stacking it. And then, of course,
mhm,
I'm immobilizing and progressively reintroducing stress to the connective tissue. So it's a whole 3-month protocol that I don't know any other podiatrist that does it this way, because I remember asking the drug reps, like the reps for the injections, and I would say, okay, what's your protocol? Like, what do you recommend for a partial tear of the plantar fascia or degeneration of the plantar fascia? And they would say, oh, we recommend 1 cc of this injection. That's it. And I was like, that's
mhm,
it? Like, what? Then what? Right? What are you doing with the patient? So when I get a patient who has tried injections, PRP, exosomes, I do Wharton's jelly in my office. So whatever type of injection they're doing, and they're like failed, that stuff is garbage. It doesn't work. It doesn't work. Don't believe in them. Negative, negative. That has to be taken with a grain of salt. And we have to understand the peripheral protocol that was given to the patient and to the cells. You're stimulating cells in the human body to create a proper repair process. That takes 3 months to go through that whole process. You have to allow the full remodeling of connective tissue to build sufficient integrity before you load it again and think that it has the integrity to load it the way you did a year ago. So that's very unique on how I look at it. I'm very passionate about regenerative injections and regenerative medicine and the protocols around them and the patient selection process. I have turned patients away also. And I'll say, even if you are willing to give me the $2,000, $3,000, whatever it is for the injection, I will not do it to you. I refuse to do it because you are not a candidate or that modality. And I'm not here for the money to do it, because then it gives a bad rep to the power of these injections, is the appropriateness of the patient and the purpose is also the power behind it.
Yeah. Yeah. So good. So important. And just because you know so much about it, that's a case in an instance where you just clearly are looking from things at such a multifaceted perspective. And I've kind of, definitely, I definitely don't know a podiatrist that's doing like the Splichal system or whatever you call this particular one. The tiered layers of it, and I have my fingers and my mind in a lot of this kind of work. Never being the surgeon who does this because I'm not. It's not within my scope. But I've
Mhm,
been alongside many surgeons doing collaborative, cooperative care, and I'm so embedded within some of these processes that I get to see what happens in a moment, and then I see not only preparing and post-op, but during peri-surgical care that I provide. So
mhm.
yeah, you have so many things from the shockwave to the photobiomodulation to all the other layers there that it's like I don't even know anybody that's outside of podiatry in the functional space that's doing these layers in a really tactical way. So that
Mm,
needs to be for sure a standard way of doing things at some point because that would be
I
such
agree.
an optimal way for people to get, as I've had many people come in telling me, Neil, I've done this and that. And I'm like, okay, so you did, procaine or you did, prolotherapy, and then you taught stem cell and umbilical. And I had one person in particular where I said, no, those, I know the surgeon and I'm sure you had great results. However, I did a very quick lead them on a protocol to get rid of some really apparent parasites that were bothering them, and it was right after that everything in that
Mhm, mhm,
person's cubital fossa cleared. And I think that's just one like pinpoint example I was thinking of. But it's like I love your knowledge of tissues because these tissues, the matrices that we have within our bodies, they're so complex. They need so much, and so if there's only one intervention being done, like you saw, you're like, wow,
mhm,
so much is missing from what that person needs. So while some might see like "Well, that's a lot, I'm like, yeah, that's amazing that you
mhm.
can guide people in that way. So um, what's the maybe just to know what's the age range of people that you see? Well, I guess we're talking a really specific thing with stem cell, but let's just say
Yeah.
in your regenerative work, what is kind of like the age range you work with currently?
Well, so I will answer and say that the age range of who I treat as a functional
Yeah.
podiatrist is literally all ages. I do
Yes.
a lot of consultations with parents for children because I think that there is a large misunderstanding of the pediatric foot,
Yeah.
particularly flat feet, in children. And the when a parent is told that a child needs like a AFO or an orthotic or something for their child's flat feet. Again, because I don't know what if the feet are flat or not, but they were told
Right.
that. So they're told to be in this, and it's not really explained to the parents. The parents should be educated that one, not all children grow out of flat feet. And then two, if you are recommended to use an AFO or a custom orthotic or a brace or a UCBL or whatever, these different braces, that the intent is not like braces. Like it's more like eyeglasses where you are holding the foot in this proper posture, not so that it can grow into that shape and then you never need the orthotic again. That's a very highly misunderstood concept in the pediatric foot space, but unfortunately, no one is educating the parents on that. So they don't know. Like, how would they understand the sequelae of a ligament lax foot in a 5-year-old and what that looks like in a 20-year-old? I know what that looks like from clinical experience, but they don't.
Hmm.
So it's my job to educate them. So that is part of who I treat. And then I
Hmm.
treat all ages.
Hmm.
And the other aspect of my practice is a lot of chronic patients, patients who have exhausted other practitioners. Maybe it is things like chronic plantar fascial symptoms and they actually have a tear, so we do regenerative. Maybe they have a neurological condition So I do see a lot of spinal cord injuries, MS, Parkinson's, dystonias, neuropathies, movement disorders, that whole bucket. And they are seeking my lens from a neurosensory perspective. So
Mm,
I'm not necessarily, I don't see patients multiple times a week and, I'm the one doing gait retraining with them. I'm
mhm.
looking at their protocol and saying, this is how you could add in more neurosensory stimulation throughout your day and throughout your protocol. Is do dry brushing, then do this. Are you doing diaphragmatic breathing? Are you connecting to your pelvic floor? Like, these are things that technically the therapist should be telling them to do, not me, but I'm checking it off. Are you stimulating the hands? What are we doing for our feet? And I add in to their protocol this neurosensory perspective. Um, but I treat everything. Most of my patients are virtual, so they're actually not in person. And I really try to provide an outside perspective when someone is wanting the non-conventional, same story, orthotics, arch supports, surgery.
Yeah.
Is I provide that.
Yeah. And I think it's a great distinction of, well, you made is that it's such a non-traditional approach, but it's not just alternative, not just functional. Such an interdisciplinary way that you're looking at people from this neurosensory lens, but also you're taking into consideration so many factors that so you give this high level overview map
Mhm.
to really help people decipher. Very much like a conductor of an orchestra, you're looking at this as like, okay, I see this moving, this working, but what about that? And I love that you're not gonna be the one to like, yeah, literally do all the gait training, the diaphragm, but you can see all these different
Mhm.
aspects, instruments, parts of someone. Um, and so you can get this big overarching like understanding of like, yeah, why is that one thing not working well, and why is that happening? And I think that's a yeah, such a really important part of that. It's like panning out from the foot to the whole body, and then the multifaceted way in which we form and interact with the world. um, yeah, so we it's kind of, I get why you call, we can't just call you a podiatrist. We can't even just call you a human movement specialist because um, it's so intrinsic about the way we function on a very, minute, we could say molecular level.
Yeah.
So there's so much to consider with what you look at. So it's a really um, yeah, amazing resource. So
Mhm.
um, yeah, with that kind of, my mind goes in so many places, but I want to go to this place because I know, and we got a little bit more time. If you wouldn't mind me asking you my question, I compromise to alchemize. You see people go from compromise to alchemize all the time. It started as, how can we go from a compromised airway to an alchemized airway? Because Neil, as an airway feeding specialist, that's what I thought of. And then my wife quickly said, Neil, why don't you get rid of the airway, um, don't get rid of airways, right? But why don't you get rid of the word airway and say, what about compromise to alchemize? Because,
In general.
so many more people have that. And it's not very linear to go from a state of compromise to alchemized, this, which is why I love the book, The Alchemist. It's one of the biggest inspirations that I've come across in terms of a text and a
Mhm.
way to look at the world. So the old king, Melchizedek, he talks to this boy Santiago in this story, and he says to this boy, the universe conspires in your favor when you are in pursuit of your personal legend. And so
Mhm.
I love that part about the universe conspiring, but I want to know, like, in all of the things that you do see, understand, and where you're going, like, what is your personal legend, Emily? Like, what is it that you were put on this planet to do? And the legend speaks to not only your destiny calling, but when you have a legend on a map and it shows you how to go from one place to the next or landmarks along the way, how do you know what's the legend in your life? Like, how do you know you're on that path of where you're going? Because clearly you're a great accomplisher, visionary, healer, so many things, a dancer as well, I would imagine. So, what's your legend, personal legend, and how do you know that you're headed on that map? where you're going?
Yeah, that is great question. I'm going to answer it in a couple different ways that
Yeah,
give
please
you
do.
some food for thought, I guess. Um, so one, I do think that part of my purpose is educating, and not even just like an educator, because that sounds a little like I'm in school, but
Mhm,
a deliverer of knowledge, which is
mhm,
kind of the same thing. And a little bit around it, which I don't know if any of the listeners, I have not found another person who's resonated with this. So maybe someone, if they're listening, send me a message and say, oh my God, I felt that same way too. But so I went to school for 13 years. That's a long time. And it was all successive, that all I knew from kindergarten to 30, I finished residency at 32. Literally 5 years old to 32
mhm,
was high level academia. And from my undergrad to med school to master's to my residency. Like that is just a massive amount of an identity. So I finished residency and I start for the first time in my life like the 9 to 5. And I was so lost. I had no I it was like my identity was stripped from me. And it was very like a soul seeking thing that I was like, I don't like that's it. I just wake up every day and go to work, and that's it. Um, and then so I started to kind of explore like, okay, what makes my soul sing? Right? I need a little something,
mhm,
right? Like what gets me excited, what gets me up in the morning, what makes my soul sing? What is it? And clearly it was something about the seeking of knowledge, but also questioning things. I think that that was inherently in there as well, is to kind of be like, but what about this? What about this? Right. And so then when I was going through my master's in human movement, a lot of it was based around like lit reviews and things like that. And I first started creating some of the education, which then eventually became an education company that I founded. But I
mhm,
was starting to identify that the moments that I am the happiest career wise and purpose wise has something to do with this seeking of knowledge, delivery of knowledge, and questioning
mhm,
things. So
mhm,
I found that what then was letting my soul sing was when I was teaching, when I
mhm,
was um, not on stage, because it's not about that, but it's about being able to deliver and empower people through knowledge. So I started to identify that. So what shifted in private practice when I was seeing patients traditionally under insurance, this is right out of residency, is that if I approached every patient as this new opportunity to educate them and empower them, and I just like every patient, I was like, let me tell you what your plantar fascia does. Like I was very into educating and empowering every patient. So I think that that was a big part of it, is that the way that I eventually spun that in my career, which this is some of the legend that you were saying, which these are like God given gifts, because I was given this gift, is to take complex medical concepts, and spin them in a way that a non medical, so a patient, a consumer, a layperson will understand. And I do it in a way that is like authentically trying to empower that patient.
mhm,
So I would do that through YouTube videos, I would do that through content, and then different companies would see that. And I get hired by companies to create videos that are telling their customers, their consumers, their community about the technicality in a way that they trust and that they can connect to. So that truly is one God-given gift that I don't know. I think part of that is that I try to read people really well, and I when I speak, I'm trying to connect to the hundreds of people in the audience. I need to see their eyes and I need to connect. It can't be like a black room. Um, so I think that is part of it. The other part that um, I feel that as a God-given gift that I then fell into was this this understanding and how I look at human movement, which is a very unique skill that I can't fully explain, but I can see the timing of things stabilizing in the human body. I can see how it's responding to sensory. So this kind of goes into Naboso and the development of the Naboso products and things like that. Is I I feel like it's my personal responsibility to now push the category of neurosensory in human movement, health, wellness, and longevity as a category because of the research that I read, and then I applied the research and was just like, "Well, there's this powerful research. Why is no one using that research to help people? Like to make a product that helps people?" And then that became the first Naboso product. And now when we get people with spinal cord injuries, this is the most fascinating one, and this is kind of your compromise to alchemize one. The that they have a spinal cord injury, it could be cervical, and they touch the Naboso products and they can feel their feet, and their feet start to kind of tingle, and it's like electric up. It's just so cool to see that now I feel like that's my purpose. It's a really really unique, but I do feel that I am living in that purpose, that I'm here and this is what I'm supposed to do. In
Yeah.
addition to being a role model to my daughter. That's my
Mm,
other. I take that very, very seriously, my role as a mother.
yeah.
But yeah, so that's what I kind of feel. And that's why I don't identify as a healer, because I don't feel that that's my role within medicine. I do heal,
Mm,
but I heal through guiding your body to heal itself in a sense.
okay. Yeah.
Um and that's where like the power of touch, like some people are just like people within Reiki and massage and their ability to feel things and even feel the emotion that is in the connective tissue as they're touching the body. Like that's not my gift, but I can see things in a very abstract way that has to do with movement in the nervous system and the fascial system.
Hmm. Yeah. Oh, that's really powerful. I think you're really well articulated in what you know is this is yeah, really beautiful. The way you know like what you're compelled to do and what your gifts are, and there are so many there. So that was really insightful, and I feel like a really good example of like knowing yourself, and I do think you yeah, clearly have such a deep but yet broad understanding. So really fun to hear about your personal legend, and also, um, yeah, getting to know you more through that. So that I wanna honor your time and kind of look at where we're at and say, I so much that you talked about was like riveting to me. I know people will they'll know where to find you with Naboso, but we'll have links to everything. But just in case, what's the best way for people to like find out more about you to those listening slash watching?
Yes. So for my podiatry practice, it's my name. So it's dremilysplichal.com. For the different Naboso products, it's naboso.com. Naboso is Naboso.com. I have a couple books that are out if people want to start to explore and kind of open that appreciation for the feet and movement and gravity and sensory. And then I'm on the social medias as just DRM DPM.
Okay. Oh, thank you so much, Emily. I loved our conversation. I really appreciate you spending this time and delving into these worlds.
Of course.
So appreciate you, and anybody listening, commenting, please comment rather, and let us know how you like this. Please follow both my podcast, follow Emily's work. I'm excited to be on your podcast soon, and so excited, so happy for our conversation. And thanks so much for doing that.
Of course. Thank you. It was a pleasure.
Thank you for listening to the Compromise to Alchemize podcast. Really excited to thank Jessica from Lunalux for the music, this track called Major. I want to thank Toshi who originally did the design work for my cover art. And then I also want to thank Alyssa, my team, for podcast publishing, my whole team, including Kat, for heading up my world. And then also definitely want you all to follow me on YouTube, follow the podcast on Spotify or Apple or wherever you get your podcast. Comment, give us a rating, and also follow me on Instagram at Dr. Neil Bulchandani so you can stay tuned to my latest. Thanks so much, and you have an amazing day.
This is major.